And I welcome everyone to the webinar. Thank you so much for joining. This is a webinar in recognition of Let's Talk about mental health. I will be one of the facilitators, Dr. Kathy Kyle. I'll introduce myself soon. And I'm very fortunate to have a co-facilitator, Dr. Leanne Benedetti, on as well. If you're having any technical issues, please text 226-347-4828, and my wonderful colleague, Laura, will help you out. Just going to move on to the next slide here. 1 second. There we go. So all of you will be automatically muted upon entry, just the way WebEx works. Some phones aren't muted, so please be mindful to mute your phone to reduce background noise. We will be using the chat function to have comments and conversations and to ask questions. And Dr. Leanne will be monitoring that chat for us. So the chat icon is the little bubble. Click on that, the chat screen opens, and then you can place your comment or question in there. Some of you may have questions about a CE certificate or even the PDF of the presentation today. And those two items, thank you to Lori at the CVMA, will be available on the CVMA website in the next day or two. And that's at canadianveterinarians.net/mental-health-webinars. All right, so let's just practice the chat. I'm sure we're all very savvy at chat now with Zoom and WebEx. However, in the chat, just to test it out, what is your favorite utensil? A spatula, nice, very practical. Turkey baster, love turkey. Can opener, good old wooden spoon. I know they're the best. I've been making a lot of bread and the wooden spoon just seems to work really well. The fridge. Yeah, lots of good stuff in the fridge. Yeah. And for me, I think it's my coffee maker. I just have a very simple Bodum, love it. And I just need a touch of coffee every day to fuel me up, but it does make me feel really good. So thank you for sharing. All right, so I will soon give more information about myself and Dr. Leanne. Really, the three goals of the webinar today is to encourage open and really honest conversation around mental health and mental illness in our work environments, in our own homes, our communities, and including our veterinary community. And to understand and break down stigma, which does exist around mental illness and mental health. And that word stigma is an important one because it means that we have a negative attitude, like collectively we, as people can have negative attitudes towards those who have mental health problems or mental illness. And the thing about stigma is that typically it's a misperception. So I'm hoping that on this webinar today, we can kind of break down some of the stigmas that may exist around mental health and mental illness. And most importantly, this is meant to be more than a conversation. I'm really hopeful that all of you think about ways that you can continue the conversation in your work environment or in your home, and to take action. You'll learn a number of community resources to help keep yourself safe and get help if you need help from a mental health perspective, but also the people in your life. Maybe it's your colleagues or your friends, your family members. So why am I one of the facilitators today? Well, I do have a very strong interest in how the mind works. I studied cognitive and neuropsychology in university in my undergraduate and graduate degree, although I'm not a licensed psychologist. Then I went to veterinary school, and I think I recognized very early on that as healers, as helpers of animals and often clients too, we ourselves can be somewhat wounded. And I recognized that there was quite a high rate of psychological distress, even in the student cohort that I was with at the veterinary school at OVC, and then as I got out into practice and experienced some burnout myself. So I started very early on to take care of myself. So I took the mindfulness-based stress reduction and self-compassion years ago, and I use those tenets all the time. I became very interested in better understanding how the awareness and the prevention around suicide. I have people in my life who do have a high risk of suicidal ideation. So I took the 2 courses from the Center for Suicide Prevention, ASSIST, which is called Applied Suicide Intervention Skills Training, and also Safe Talk. And I'm certified to teach Safe Talk, which is a suicide awareness and prevention course. I've also taken the mental health first aid course, the best 2 days you could ever spend learning about mental health. And I'm also taken compassion fatigue, so I'm a compassion fatigue educator, very active in different organizations. I'm a member of the Canadian and the Alberta, I'm here in Calgary, Alberta Veterinary Medical Association member wellness committees, an advocate for mental health in our profession. On a day-to-day, I'm very fortunate to work for Merck Animal Health as a technical services veterinarian. And in 2019, with Merck's help and the Canadian Vet Medical Association, I spearheaded the very first time to talk about mental health and vet med awareness campaign. We have quarterly webinars. So this is our 7th webinar and the 3rd year that we're hosting this campaign to really enable the veterinary community to come together as a community and talk about mental health and look after themselves. And I'm a practitioner of wellness in everyday life, meaning that to be well, it's a practice. No one is an expert at it, and there can be bumps and ups and downs along the way. But you can see that one of the ways I have joy in my life is spending time with my dressage horse, Flora. And I'll move it on now to my co-facilitator, Dr. Leanne.
Thank you, Kathy. I'm here today as a veterinarian who has, in my practice life, which is coming to 25 years this May, definitely struggled with work-life balance and the challenges that are associated with what this profession brings to us. I, unlike Kathy, did not really fully understand or comprehend that from an early age. It's been about 5 years since I really, A, personally experienced challenges, and B, really understood what that meant and how over time I had not adapted particularly healthy coping skills and coping mechanisms. So I'm here today with that lens, which has prompted me to, I was a practice owner. I've been a mobile practitioner, a mixed and small animal practitioner. I sold my practice in 2019 and still work there 2 days a week. However, I have become an executive coach, certified coach, and I'm really hoping to provide one-on-one support to our veterinary peeps that may need it. And so I'm very excited to be here today, as well as really passionate about offering people the support, A, that I didn't really realize I needed, and B, that once I finally found it, really understand the value of. So really looking forward to this conversation today. I also am a compassion fatigue practitioner, and I have embraced Brene Brown's wholehearted living concept that is all about being intentional and mindful and understanding that my best is my best. And that's what I can give. And I am super excited. And I am monitoring the chat today. I am also happy to say that we are just in the early stages of putting together a peer support group for veterinarians throughout Canada. It's in its very early formative stages, and I'm really excited to be the co-director of that group. So continuing this conversation on many platforms. And I'll turn it back over to Kathy.
Thanks, Leanne, and I'm so excited to have you here. And on that last note about the National Peer Support Program for Canadian veterinarians, it is in its infancy stage. However, we've got about 27 passionate veterinarians who have come forward with interest in the program. If you're interested in learning more about the program or becoming trained to be a peer support volunteer, please email Leanne. And I think Leanne's email is many times throughout the presentation, but likely in the chat as well. So talking about mental health problems and mental illness can be an impetus for us to be self-reflective And that may mean that emotions and thoughts come bubbling up to the surface, which can be overwhelming. And if that is the case for you, please look after yourself. Perhaps stop listening to the presentation, step away and just take a deep breath in through your nose and out through your nose. And then come back to the webinar when it's the right time for you. And then recognize too that talking about our thoughts and our feelings is really helpful because it gets it off of our chest and also makes us realize that we're not alone in this. So think too, and maybe you've done this already, talking to your peers, your colleagues, friends, family members. You may have counselors or psychologists in your life already, and speaking with them or your general practitioner or spiritual advisor. Many of us have access to an employee family assistance plan that's called EFAP through our Provincial Veterinary Medical Association. And those employee family assistance plans provide counselors to be able to talk with us on a variety of topics. It doesn't need to be just mental health. Maybe you're struggling right now with elder care in the time of COVID or financial stress or managing so much going on at home right now with homeschooling and your partner being home. Make use of those employee family assistance plans. Call in. You don't need to ask your manager or your supervisor for permission. It's complimentary. It's anonymous. And I use them all the time. In fact, I have a 5 series of counseling with one of the employee family assistance plans. And I have my next appointment with my counselor tomorrow virtually. So it's a fantastic opportunity to stay grounded. And then if you're not a member of a VMA, so usually RVTs and veterinarians are, however, for all the other veterinary professionals who I'm hopeful are on the webinar today, think about your provincial 211 phone number or website. Nearly all provinces in Canada have this set up so that you can call or go onto the website, and then it will take you to a list of community resources that are based on social services. Often they're free, and they have a lot of mental health help lines that one can access. So that's really good for other colleagues, friends, family members, even clients who you know may be struggling. When we did the webinar last September in 2020 in recognition of World Suicide Prevention Day, we launched this sticker, and it's available for free download at the CanadianVeterinarians.net website. The link is in the bottom of the screen. And this image is really intended to help people realize that if they're struggling and if thoughts are getting the better of them, that there are people who want to listen to their story and provide help. So this phone number is the Canadian Suicide Prevention phone number. However, do keep in mind that this phone number is more than just for suicide prevention. It's for anyone who is in crisis or in distress. And the trained volunteers and the professionals who are on the other end of the phone do not judge what distress is. Crisis or distress for one person may be something completely different for another person. So this poster was made in conjunction with the Merck CVMA Time to Talk campaign and the Center for Suicide Prevention. And I'm hopeful that you'll download it. You can print it out on adhesive paper or print it out on regular paper and place it in your clinic in areas where people may be in distress, and you want to ensure that they get help to stay alive and stay safe. So in 2010, the Bell Corporation started a Let's Talk campaign around mental health and mental illness in Canada. And at the time, not many people were talking about this. And the numbers spoke volumes of the urgent need, though, for action around this conversation. So since the 2010 campaign, it's an annual campaign, and today is the day. This is Bell Let's Talk Day. Now, millions of Canadians, including leading personalities and celebrities, have come forward to talk about even their own journeys within mental health and mental illness. And so the webinar today will do a few things. One is to have open conversations around mental health and mental illness, and also help us bust through some of the stigma, these negative attitudes or perceptions that we have around mental health and mental illness, and get more information from a fact-based perspective. So on that note, I'm going to open a poll question. So just one moment as I do that here. So I'm going to open this poll question, and the question is, in Canada at any one time, how many people, one second here, I'm just going to make this a bit bigger. How many people have a mental health concern or issue? And so choose the answer that you think is most, resonates with you. So I'm seeing that people are voting, which is awesome. And I'm seeing some trends emerge. Seeing that the voting has slowed down. We've got about 80% of people have voted, which is fantastic. I'm going to close the poll, and I will show the results on the screen. Hopefully you're able to see them all. So it looks like that about most of us chose 2 and 5, which is 40%. And the data, and there's really no wrong answer because it really depends too on how one defines a mental health problem. However, at any one point in time, about 1 in 5 people in Canada will have a mental illness. One second, I'm just going to close this over 1 sec. And even if you haven't experienced a mental illness, chances are someone close to you has or will have a mental illness at some point in time. And in the workplace, the prevalence of mental health problems or illnesses is a tiny bit higher. It's 1 in 2 workers in Canada say they have or have had mental health issues. And approximately 500,000 Canadians will be absent from work for mental health issues every day. And depression and other mental health conditions and illnesses are the leading cause of workplace disability. I just want to take a chance here and mention that there are some definitions on this slide. You may be thinking, well, what's the difference between a mental health problem versus a mental illness? So let me take the mental illness first and just unpack it a little bit more. So there is a manual that psychologists and psychiatrists will use. It's called the Diagnostic and Statistical Manual of Mental Illness, the DSM. And that manual uses common language and standard criteria to classify and diagnose a mental illness or a mental disorder. So I'll use anxiety as an example. I am one of those people who have anxiety. So I have signs of nervousness or sometimes being afraid for no particular reason. And those behaviors and symptoms can vary from time to time, but they're not intense enough for me to be diagnosed with having an anxiety disorder. And an anxiety disorder, like a generalized anxiety disorder or phobia or a panic attack, would be when those behaviors or symptoms are long lasting, so typically more than 4 weeks. They're very intense. They interfere with the person's ability to lead their life in a day-to-day way. The behavior and symptoms are so intense that they have negative consequences in many aspects of the person's life, so work, relationships, school. And in the case of anxiety, the fear is existing without the presence of real danger. And that's when anxiety behavior and symptoms becomes diagnosed as an anxiety disorder or generalized anxiety disorder, phobia, or panic attack by a psychiatrist or a psychologist. Now, the word mental health problem is a little bit more of a broader term where mental illnesses get encompassed within mental health problems. A mental health problem meaning that a person has a behavior or a symptom of a mental illness. However, they can vary in intensity. Some days they might be better or worse than others. And they may also be in relationship to something that is happening to that person. Maybe it's a particular stressor in their life. Maybe it lasts a day or a couple of days or a week, or perhaps those behaviors or symptoms are present because of an extenuating circumstance in one's life. And if that's the case, then that person would not be diagnosed with a mental illness. It would just be recognized that those behaviors and symptoms are present, but they can vary in intensity and they can come and go. So hopefully that helps, because often I I'm asked that question when I do particular webinars. I also see that the chat is really active. Leanne, anything to talk about specifically with respect to the chat?
No, just the comment around the fact that, you know, if on a survey or reported it's 1 in 5, it's probably higher than that due to the silence.
Absolutely. Yeah.
Lack of recognition. So yes.
So true. Yeah, that's a combination of self-stigma, a lack of recognition, and perhaps even the way some people may respond to things like surveys, where they're feeling perhaps a bit ashamed or embarrassed to be truthful in how they're feeling. And I'm hopeful that we can kind of break through the stigma on that. So I'm going to open another poll question. This slide just reminds me to open a poll question. So the next poll question is around psychological distress. So I've listed out there a number of symptoms, behaviors of psychological distress, and which ones do you think are indicative of psychological distress? I'm seeing people are voting. Fabulous. I'm trying not to make any of these questions too tricky. So it looks like most of you are nailing it. It really is all of the above. And I'm going to close the poll and I'll just show you the poll results because most of you have indeed said that all of those symptoms are indicative of psychological distress. And the reason I chose to use those symptoms is because they're part of a scale called the Kessler Psychological Distress Scale. And this scale has been used by psychiatrists and psychologists to be able to survey people to determine the presence or the absence of psychological distress. And in fact, this scale was used in 2 studies of US veterinarians to evaluate their well-being. One study was in 2017 and the other was in 2019. And these studies were done in collaboration with Merck Animal Health US, the American VMA, and also psychologists and social workers. And the data showed that 1 in 20 veterinarians were classified as having serious psychological distress using this scale. So you might be thinking, is that higher than the general US population? And statistically, no, it's not. This works out in the 2019 study to be about 6.4% of veterinarians. The US general population has a prevalence rate of about 4.7%. Of people being through this scale being assessed as having serious psychological distress. And the way the scale is set up is that the symptoms that you just saw on that poll question, people would answer that in the past 30 days, they have experienced those feelings, and they would rate the intensity and the frequency of those feelings on a 5-point Likert scale. So I mention this because I think it's important for us just to dig a little bit deeper into what is happening with respect to mental health and mental illness prevalence in our veterinary professional community. Now, in the 2017 and 2019 study that I just spoke about, 67 up to 79% of associate veterinarians did report depression, anxiety, panic attacks, and compassion fatigue in the last year. And we'll see that there were some risk factors for serious psychological distress in those 2 studies. Certainly, the younger cohort of veterinarians is at higher risk of having serious psychological distress, which concerns me because this is the group of up-and-coming leaders who we have in our veterinary professional community. And then other risk factors for serious psychological distress was around working. So working more than 45 hours per week, working evening hours or working holidays, working more or fewer hours than desired. And specifically, the 2019 study showed that working fewer hours than desired was more stressful and more indicative of having higher rates of psychological distress than working more hours and also having financial debt. Female veterinarians also, based in these 2 studies, experienced higher levels of psychological distress than their male veterinarians. And that's concerning because we know here in Canada, about 3/4 of veterinarians are females, and females are an expanding area of veterinary professionals in Canada, just based on statistics. Now, I've spoken about veterinarians to this point in time. Sadly, there's not been a lot of research looking at mental health or mental illness in veterinary students, registered veterinary technologists, veterinary assistants, or other veterinary professionals. And we know that they're exposed to very similar working conditions, and undeniably, they would be at risk of psychological distress and mental health problems and mental illness, as veterinarians are too. So of the research that has been done, one great, very comprehensive study in 2015 with students of the American Veterinary Medical Association sadly showed that about 37, almost 40% of student veterinarians were diagnosed with clinical depression, and 67% of them had symptoms and behaviors indicative of depression. 47%, so nearly 1 in 2 veterinary students have a personal history of depression, anxiety, or substance misuse. And then a comprehensive study in the UK of registered veterinary technologists using a scale called the Pro Quality of Life Scale revealed that almost 93% of veterinary technologists at moderate to high risk of burnout with elevated risk of depression. So I say all these things not to bring us too far down, however, just to be more aware of what is going on around us so that we can start to have open dialogue around mental health and mental illness, and particularly break through stigma by having facts rather than looking at misperceptions. So another cue to me to open a poll question. So the next poll question is, what do you think about mental health, people with mental illness and one's ability to function in the work environment? So this is a good question to help us think about perceptions that we may have around people who have mental illness. I can see that many of us are already busting through that stigma, which is great. The answers are coming in fast and furious. Most of us are saying true. I'll close the poll now and just show you the overall results. It looks like the vast majority said true. And absolutely, people with mental illness can and do function very well in the workplace. The data demonstrates that they're unlikely to miss any more work days because of their condition than people living with a chronic health condition like diabetes or heart disease. And I also think it's important for us to really be present to the fact that if we were even to disclose that we have a mental health problem, like I did earlier with anxiety or a mental illness, it's not a barrier to achievement. It doesn't mean that I'm not fit to do the work that I do at a very high level of success. If someone in the veterinary work environment, like a clinic, was to say, I'm struggling with this or struggling with that, it doesn't mean they're not fit to practice. So I'm hopeful that by talking about this, we can help shift attitudes that we may have and be more able to embrace people who have mental health and mental illness in the work environment, and to trust them. Some people may have the perception that people with mental illness or mental health problems are more violent or can't be trusted. And that's not the case at all. In fact, people with mental illness and mental health problems are more likely to be the victims of violence. And then that point about chronic health conditions like diabetes or heart disease, I want us to really be mindful that someone with a mental health condition or a mental illness can still be mentally well, just like someone with a physical illness like diabetes, or an animal with diabetes, with the right nutrition and management and exercise. That person with diabetes, a physical illness, can be physically well. So I'm hopeful that you can see that those two things aren't dichotomies. A person with mental illness or mental health problem can still be mentally well. All right, so another poll question. All right. So I'm opening this poll. Which of the following are real illnesses? So diabetes, anxiety, worrying a lot, flu, or all of them? I'm also looking in the chat and seeing that there are some really insightful comments. I like that there's conversation going back and forth. That is fantastic. Oh, you guys are nailing this. Excellent. All on your game today. Yes, all of those are considered real illnesses, and including mental illnesses, they're bona fide medical conditions. And so people with mental illnesses have serious symptoms which aren't within their control. So you may have been, and I was this type of person in the household I grew up in, and my sister has a number of mental illnesses. I would hear my mom say to my sister, just pull up your socks. It's all in your head. Work harder, push through it. And those are stigmatizing statements. And I'm not saying that in a negative sense against my mom, because likely at that point in time, she wasn't educated on how mental illnesses showed up, that they do have a physiological and a brain pathology component. And they're also caused by a number of conditions. But that's an example of stigmatizing attitudes. And the research shows that there's so many different causes of mental illness, biological, genetic, social, and very importantly, mental illnesses can be treated. They can be treated successfully. In fact, some mental illnesses can be cured with different types of treatment. Now, we don't have time to go through the common mental illnesses and mental health problems that do exist in the community in general. What I did do in recognition of the time to talk about mental health and Vet Med awareness campaign is I've written a mental health and mental illness checklist of the common conditions like anxiety, depression, mood disorders, and substance misuse, with many links and resources in those documents. There's one in English and one in French, and they're available for download at the CanadianVeterinarians.net website with the URL in the bottom of the screen. And the PDF of this presentation, with all the links being active, as well as your CE certificate, will be on the CVMA website in the next day or two. All right, one more poll question. I'm sure you're all getting tired of poll questions at this point in time, but I have one more poll question. And this one will open in 1 second. And it refers back to the 2017 study. And what percentage of veterinarians do you think responded that veterinarians are caring towards those people around them who may have a mental illness? So 13%, 24%, 57%, or 94%. This can be a challenging question because in some cases we just may need to go in our gut feel here. I'm seeing that there's chat too about the employee family assistance plans, and that's great. Many clinics have their own employee family assistance plan on top of the provincial VMA, which is fantastic, through different providers. I'm going to close the poll and I'll show you the results. And you'll see that sort of a split. 30% said 57% of veterinarians are caring towards people around them who may have mental illness or mental health problems. And then the next largest proportion of us chose 24%. So let me reveal the actual results. And it was from the 2017 data, 24% of veterinarians were caring around those around them with mental illness. And in the 2019 study, fortunately, the results revealed that there's a higher percentage of veterinarians who are caring to those around them with mental illness. So this is a great example of how awareness and understanding of what mental health problems and mental illnesses are can shift our attitudes, right? Our perceptions. So we went from having maybe a higher rate of stigma to having a lower rate of stigma around mental illness. And let's continue to do that. And please, all of you continue to do this by having conversations around mental health and mental illnesses in your own communities, whether it's your work community or your home or the community of friends that you are with. And now I just want to go through some other results from the 2017 and 2019 study. Again, this is a study that surveyed nearly 3,000 veterinarians in the United States in 2017 and a different cohort of 3,000 veterinarians in 2019. And this was a study that Merck Animal Health did in conjunction with the American Vet Medical Association. So they asked veterinarians, do you think mental health treatment is accessible? And we see about 60 to 61% of the veterinarians responded yes. Hopefully that will go up with time. And I certainly think having webinars like we are today, where people are talking about the Employee Family Assistance Plan that they use and have access to, recognizing, for instance, that in each province, we can use 211 in order to access free mental health resources and community social services. I see, so two things. I love that people have joined. Just be mindful, even though the system mutes you automatically upon entry, if you have a separate microphone, please mute it so that we can reduce background noise. Thank you. And I see that someone has a question.
Yes, Kat.
Oh. Mm-hmm.
The question is, do you have any statistics on the percentage of psychological distress between human doctors and veterinarians?
Yeah, it's a very good question, and it's very similar. I anticipated these sorts of questions, so I did just a general kind of environmental scan of some of the research. And when we look at something like anxiety in veterinarians, so first off, anxiety in the general population, about 1 in 10. And a study that Colleen Best and some other amazing folks at OBC did not too long ago revealed that of 500 Canadian veterinarians, 1/3 of the Canadian veterinarians were diagnosed with anxiety and 1/3 were borderline. Physicians, their prevalence of anxiety is about similar to that, maybe a little bit higher. In that study of Canadian veterinarians looking at prevalence of depression, it was fairly similar to the general population. So the general population in Canada, 13% of adults are diagnosed with clinical depression. And in that study of Canadian veterinarians, it was 1 in 10 diagnosed with depression, 1 in 10 borderline depression. Physicians, their prevalence of depression was quite a bit higher in the scholarship that I looked at. About 25% of physicians are diagnosed with clinical depression. So the psychological distress in general is the same, but when we look at some of the mental health illnesses, there is some difference. So then let's just move on to some other research findings from these studies. Interesting, when the veterinarians were asked, mental health treatment helps veterinarians lead normal lives. In 2017, nearly 80% of veterinarians said yes. That went down to 68%, which is not the way we want this to go. So I want us to think about a few things that go back to what I mentioned earlier, that mental illnesses can be treated. They can be treated successfully. Because mental illnesses are caused by a myriad, in some cases, of causes, biological, genetic, social, it's the treatment can be a myriad as well. It can be multimodal. So for some people, it's counseling. And even if counseling doesn't work for that particular situation, there's so many different types of counseling. Cognitive behavioral therapy. I know, Leanne, you're learning a lot about dialectical behavioral therapy. So if you are the kind of person who is looking for therapy and looking for counseling, ask your counselor what type of therapy they provide, because maybe one mode is going to be more effective than the other. And then there's different ways of self-care, peer support groups. There's a lot of evidence to show that peer support groups helps people who do have mental health problems and mental illnesses be treated successfully. So I'm hopeful that through these conversations, we can, as a group, we could say, yes, mental health treatment does help veterinarians lead normal lives. And then 2 new questions were added to the 2019 survey. I feel comfortable discussing mental health topics with peers and colleagues, 60%. And if needed, I would be comfortable taking time off to receive mental health treatment. That was lower at 54%. And there's likely a number of underlying circumstances there. Maybe people can't take time off because they're a sole practitioner. However, I think with COVID, it's just enabled all of us to have more connection virtually to others, including counselors and psychologists. So it's very easy to even fit these counseling sessions in and taking time off for mental health treatment in our day-to-day. And people with mental health problems may find themselves not reaching out for help because of fear. Fear, self-stigma, maybe they're feeling embarrassed or ashamed for their brain being the way it is, or perhaps being a burden on others. They may be afraid that they will be stigmatized or judged as not being fit to practice or not being an effective or competent veterinary professional. That couldn't be further from the truth. However, those self-stigmas are very, the World Health Organization calls those self-stigmas the hidden burden of mental disease, that they can be even more challenging than the mental disease itself because it gets in the way of people reaching out for help. So the data does show that about 52% of veterinarians who were assessed as having serious psychological distress did not reach out for help and did not get the treatment to help them. So just a few things about the word okay is that it's okay to not be okay. The thoughts that our mind can have at times is just part of the spectrum, part of the continuum of being in mental health. And it's okay to talk about it because by talking about it with others, you're normalizing it and you're telling that other person that you're the type of person who's okay to listen to those sorts of conversation. And it's certainly okay to ask for help. You'll feel like a huge burden is lifted off your shoulders. So as I mentioned before, we've got clinic and veterinary medical associations, employee family assistance plans. 211 is a phone number and website to use in your province. And one employee family assistance plan provider, Home with Health, along with the Government of Canada, has provided a Wellness Together, which is a free counseling service for all Canadians. And because each province VMA has an association with employee family assistance plan provider, I put together all of the phone numbers and all of the websites of those providers in this mental health resource list in English and in French, and it's available to download from the CVMA website. So let's make use of the chat because we've talked a lot about mental health problems and mental illness, but I'm really curious to hear from all of you. What does mental health mean to you? So I see the chat has been active already. So thanks, Leanne, for putting the question in. Yeah, let's hear from you. What does mental health mean to you? And as people are chatting in, again, it's okay to share with others when you're struggling. If I hadn't talked to my general practitioner in 2010 about how my anxiety and my nervousness was getting the better of me, I wouldn't have received the suggested treatment interventions that I still use today. And I'm not pushing psychopharmacology at all. However, for me, taking a selective serotonin reuptake inhibitor enabled me to do better care, stabilize my moods, and be the right type of person for my relationships. So really interested to hear what mental health means to you. The answers are coming in. Thank you. Yes, life balance of work, family, and inner being. Very important, that sense of balance. Mental health means being able to function day to day and maintain interpersonal relationships. Absolutely. The recognition that how we show up can affect other people. I love it. So mental health means having the mental capacity to deal with whatever challenges you face day to day. Personally, everything I feel, if you're not mentally well, you cannot be physically present. So that interrelationship between mental health and physical health, absolutely. Beautiful self-disclosures, people struggling with clinical depression. Thank you for being honest and sharing that, and have ended up putting myself into the psychiatric unit twice to get the help I needed. Brave and courageous of you, and I'm so happy that you did that, as I'm sure your family and your friends are as well. Support is so important, and yeah, making use of mental health, exercise, like physical health, the emotional health. Wonderful. Good night's sleep. Absolutely. You guys are nailing this. And I want to, again, from an education perspective, just bring you to the definition that the World Health Organization uses around mental health, because it encapsulates everything that I'm seeing in the chat, which is that it's well-being. It's a state of well-being in which every individual realizes his or her own potential, can cope with the normal stresses of life, can work productively and fruitfully, and is able to make a contribution to her or his community. And I saw this in the chat, and I'm continuing to see it in the chat, is that sense of health being very holistic, that we have elements of health, physical health, mental health, emotional health, and spiritual health. And we need to have health and balance in all of those components in order to be well in an overall sense, in order to have that sense of well-being. So continue in the chat, sharing both how you envision mental health, and also, and I'm seeing this already, I saw someone type in sleep. What do you do to take care of your own mental health?
Kathy, we have one question in the chat that says, any stats on the percentage of vets or people struggling with mental health who don't respond to medication?
Oh, very good question. And no, I don't have that answer. I would suspect, though, based on the reading I've done, is that it would vary from mental illness to mental illness, anxiety versus depression versus mood disorders. So I don't have the actual statistics. However, Google Scholar would be an awesome place to go and just Google that to find out, what percentage of people don't respond. The key, though, about not responding is that there are so many different types of interventions, and just like the causes are multifaceted, the treatments tend to be multimodal. So even if, I'm just going to be very narrow spectrum here, even if one psychopharmacological agent doesn't work for one person, even within that family, say of selective serotonin reuptake inhibitors that I'm on, if one molecule in that family doesn't work for one person, perhaps another molecule could, or a different dosage. So I say that so that we don't look at that as an unhopeful situation. So I'm going back to the chat, and I'm seeing that there's exercise, there's art, there's creativity, there's journaling. I'm seeing the word grounded. And all of these things are awesome, because what it's telling me is that you're doing something every day, or maybe several things every day, which you love to do. And that is the key on taking care of your mental health. Here in Alberta, there's a psychiatrist named Dr. Peter Silverstone. He works at the University of Alberta. He is amazing. He has been on CBC Alberta many times talking about mental health and wellness within, especially particularly the times of COVID. And he narrows it down to three things: eating, trying not to eat junk food, trying to eat healthy when we can, and making sure that we eat prior to getting hungry, so that we're fueling our brain. And he reminds us that some foods have a positive effect on mood, like a handful of nuts contain omega fatty acids, and there's bodies of research demonstrate that omega fatty acids enhance our mood. He also talks about the relationship, as we all know, right, between a healthy gut microbiome and mood. He reminds us that going to our doctor, getting a vitamin D level assessed, especially in Canada, where we have less daylight hours than other parts of the country. All of those things are important when we think about nutrition and then sleep. And I'm seeing sleep in the chat quite a bit. It's difficult though, right, for us to get sleep based on sleep hygiene, things that are happening at our work, at our home. So please check out sleep hygiene resources at the Canadian Sleep Society, CSS. Great resources. And just to remind you, maybe a bit of impetus to go there is if we have 3 nights in a row with 5 hours of sleep or less, it's like operating at a 0.8 blood alcohol level. So operating at that level means it's going to affect our executive function, the front part of our brain that makes decisions and comes up with solutions. So we could see how a lack of sleep can really affect our ability to make good decisions. And then the last thing that Dr. Peter Silverstone talks about, and I'm seeing it again in the chat, is exercise. Just 15 minutes of movement daily. And I know some of us can have certain narratives or stories around eating and exercising. All we need to do is move our body. And he recommends also moving our body in a contralateral way. So we're moving our left side of our body a little more independently than our right side of our body, because that brings the left and the right hemispheres working together. It gets the corpus callosum, the band of tissue between the right and the left hemisphere, really working actively. Excellent. Those are all. And so continue to go back to the chat and see body scans and cannot move their bodies. Absolutely, with injuries. So think too about even just moving our lungs, right? Our lungs are part of our body, taking deep breaths in and deep breaths out. That helps to move blood in our body, helps to lower negative stress hormones like adrenaline, and just helps us to be more present. And then there's even parts of our body that we may be able to move. Maybe it's curling in our fingers and releasing them, and that just helps to release tension. So do talk to your physician if you're in that situation about what parts of one's body could be moved in a way that gets blood going and helps us to shift out of our thinking. All right, so one of the goals was to keep this conversation going beyond this webinar. The Bell Let's Talk website has great tools. Everything's available in both French and English. Download the toolkit. There's stickers and posters and email signature and social media too that you could post. And download the conversation guide. The conversation guide is an excellent way to develop some skills and have some ideas on how to have a conversation with a colleague or a friend who looks like they're struggling, who looks like they may be in distress. Sometimes we get that gut feeling that they're just not themselves that day. And that guide helps you have a conversation with that person. And it also has a list of signs and symptoms and behaviors when people are in distress at the back part of the guide. So that's all at the Bell Let's Talk website. I mentioned earlier about the mental health first aid workshop. This is a 2-day course put on by the Mental Health Commission of Canada. During the time of COVID, they've pivoted and now they're offering it virtually, a little shorter. So it's about 8 hours in total, so it's not a full 2 days. This is the best 2 days or 8 hours you could spend learning about mental health. And just like in every vet clinic, in every work environment, we need to have a certified physical first aider. I would love to have, at some point in time in every clinic, a person who is also certified in mental health first aid. And this course does not train us to be counselors. We're not counselors. We have to stay in our lane as veterinary professionals. However, it makes us more mentally healthy in a literate sense. So that, imagine working in a work environment where you're able to talk with people about how you're feeling from a mental and emotional state and not be judged or not be discriminated against. Or likewise, if you're that person who people speak with, that as you hear some of their stories, you don't get overwhelmed or you don't check out. Or to have the skills to be able to approach a client who's in distress around a particular diagnosis or a decision they need to make with their animal and know community resources to connect them to. And that's what the mental health first aid course does. And I've taken it. I know many people who have taken it here in Alberta. Our Alberta Vet Medical Association helps to organize 2 cohorts of mental health first aid every year. And quotes like, I learned more about what was going on inside of me and that the thoughts were not normal. And I realized I needed help and got the help So it not only helps us understand mental health to help others, it can also improve recognition in ourselves. So the links are there on how to register for a face-to-face or virtual instructor-led course. So that would be a wonderful action to do sometime in 2021. And I just want to finish off with a reminder of resources and things that you can do after the webinar so that you can continue both this conversation and take some actions. I've already talked a lot about the resources available on the CVMA website, which is part of the Merck Animal Health CVMA Time to Talk campaign. And then I'll just turn it over to Leanne because she has resources on her website and also has some amazing courses coming up as well.
Oh, thank you. I just want to say that there is so much great conversation happening in the chat and so supportive, and a lot of great questions have come up. So I've been really honored to be monitoring that. So thank you. And I think that from my perspective, as today I've been reflecting on this day and the conversation and everything, to speak to the, you know, asking the question, the simple question of, are you okay? That's actually for me, someone asked me that question. And after, I'm going to say, months and years with my head down, showing all the behaviors that are listed in that kind of distress category and not being able to see them for myself, the moment that actually one person took to say, are you okay, is the moment that the floodgates opened. So you can really make a difference with that simple question and create self-awareness for people, for yourself, for the ones that are struggling, and to provide support as well. So I just wanted to share that. And you know, safety is the lens that I try and work through. And I am aware that working in the coaching space with veterinarians talking about mental and emotional health, that is a very specific difference between the therapy roles and the mental health clinicians, which I am not. I have no experience with. And coaching, which is, you know, very forward focused and trying to sort out how to get from where we are now to a spot that we want to get to. So that's my goal as a coach, is to really meet people where they're at, and that may be a very difficult space, and try and help them bridge to resources and work with you to you know, kind of figure out how to move forward. And that's what most of my courses and offerings are about. So definitely there is a course coming up, and I'm working with some clinicians on creating some real life coping skills and real life skills that are really valuable to people. For me personally, that's the skills that have helped me. So that course is coming up soon. So if you want to reach out to me about that, then that's great. And yeah, just thank you so much for being a part of this conversation with everyone today. I really, really appreciate it. It's one of the pieces of magic in my day, for sure.
Thanks, Leanne. Your comments makes my heart sing. And the comments in the chat are incredible. I love reading about medications being the emotional insulin. Love that. And painting nails, like art therapy is a fantastic. We're not all artists, but painting nails, what a great way just to get out of your mind and doing something tactical and somewhat creative. I'm seeing, and on this slide, we're really thinking about gratitude and kindness. I'm seeing that some people do a gratitude journal, and there's a body of evidence to show that writing, journaling itself, helps to improve the neuropsychology and the pathways in our brain. And then extending gratitude towards others is just a great way to feel more balanced and full ourselves. And I'm also seeing that sense of humor, right? Not taking ourselves too seriously. So all of these self-care and well-being suggestions are fantastic in the chat. Thank you for keeping that active. And I'm going to close out here. We're pretty much right on the hour, but I know Leanne and I will be on the webinar for a few more minutes if you do have questions. But I want to thank you from the bottom of my heart for joining this webinar to help create positive change regarding mental health in our veterinary profession. And let's continue to have the conversation and do really meaningful things to help keep each other safe. So with gratitude and kindness, I'm here with my email address and phone number at any time. Please reach out. And Leanne's email and phone numbers on the slide as well. Again, this was being recorded, and the recording will be available on the CVMA website in the next day or two for those who were not able to attend, and perhaps you know some people who want to listen in afterwards. I'm stopping.